Pauline, you've been working in Mandera in the Nomadic Health Project, and you had a front row seat in seeing how gender plays out within the community health workforce. Could you share some examples of this?
So thank you so much, Angela. In my role, working in the Nomadic Health Project in Mandera, gender played out significantly in our project. And in some of the ways that it played out were in, for example, the community health volunteer selection process. During our selection exercise, we visited the communities in Mandera, and our aim was to select the community health volunteers and the community health committees. And in our work, we realized that most of the plan was to ride on the existing community health committees and the existing community health volunteers. But we realized that majority of the existing community health committees and the majority of the existing community health volunteers were all men in this community. So none of these had women, and that was a major challenge. And while we selected women to be part of the community health volunteers, another challenge arose where the women could not attend a consecutive 10 days training for the CHVs. And the reason was that the women were majorly taking care of the households as well as the small animals in the community, while their men went out for grazing of the camels and other bigger livestock. The other issue is that the women could not attend the trainings unattended. So that meant that if we were to identify our women and select them as a CHV, then they had to be accompanied by a male to the training. The other thing is that distance was quite a challenge, and it was difficult for the women, some of whom had small children, to attend this training. And for these majority of these women that we selected, the men said that they could not attend the training on motorbikes. So that meant that if we needed the women for the training, then we had to provide a vehicle for them to attend the training sessions. The other thing is about the female community health volunteers conducting household visits, especially in households where there was a man. The spouses of these female CHVs felt that they felt a bit insecure while their women visited other households where there was a man, which actually was a challenge for some of these women. The other thing is about the literacy levels of the female CHVs, where you realize in this particular community, the parents prefer educating their boys more than their girls. And actually, when the women get to the age of about 10 to 15 years, they are ready for marriage. And so these communities, you'll find that either the girl is not educated, or if they have gone to school, it's maybe until class 8, that is, they've not gone past primary school. The other thing is about the community health extension workers in the community health strategy. We realized that it was a challenge deploying the community health extension workers to the rural areas. And the reason they gave is that they had other responsibilities at the family level. So that meant that they would not be able to go and work in the nomadic and the semi-nomadic communities that were quite far and that were mobile and moving all the time. So most of them preferred working around the town areas. So that meant that majority of our nomadic and semi-nomadic communities did not have community health extension workers who would supervise and guide them as they did their work.
Thank you, Pauline. And you said the community, you were keen on ensuring that there were female community health workers selected. And community health worker selection is a community-led process. Was it difficult to get the community to appoint female community health workers?
So what we did is that we had an open dialogue with the community members, including the chiefs, the religious leaders, and other community members. And we took them through the project, what the project entailed, and the importance of having women as community health volunteers. And after quite some time of discussion, then they were convinced on the importance of engaging women as community health volunteers. We also did a values clarification and attitude transformation exercise, where he emphasized on the importance of having representation of the female gender in the community health volunteers selected.
Thank you, Pauline.